One question I have, this is more of the challenge question. Forward head posture. I've seen forward head posture since videos were created. People had look down jobs forever, and my father has extreme forward head posture. My neighbor is shifted forward and crooked like a question mark, but they're living okay. They're fine. They go to their flea markets. They live normal. So why is it that some have forward head posture, but they don't have any problems? They're living okay.
So my answer to that is, like you used for an example, your father, right?
Yeah.
And so the older generation, they got this very slow over time, because what they did was, over time, they weren't on phones and computers, right? So over time, from look down jobs and things, they got this way, but it was very slow and gradual, and the body could accommodate and adapt, and innate intelligence, God-given ability to heal, figured out how to do it correctly. But now, like never before, we've been on these things like nonstop, at a rate that's never happened in human history, and it's created new and different problems in the spine that the body didn't have time to innately adapt to. So now we're all much more vulnerable to neck injuries.
That makes so much sense.
It was over time. You might have read the paper on Sunday, right, and had a bad posture, but then you went out in the yard and you cut the grass, right, and then you went to, meet with friends. And so now people will be 8-10 hours a day like this, and they won't get up except to go to the bathroom and maybe drink a little bit of water, and then they're just sitting like this. And then they get in one car accident and they're here, boom, and their upper neck was so weak. And before, people were stronger overall with these kind of conditions.
Yeah, and especially now. I mean, we are in a genetic world, the mutation genetically. I mean, EDS went from 4%, now it's extremely high. I mean...
Okay, good. You bring in the other part too. Chemicals over the last few generations have definitely increased, and maybe our connective tissue is not as strong on average. We could look at, there's probably a way to test that, but that's a good theory.
Yeah, especially ever since Carnation Instant Breakfast came out, aluminum cans. I mean, I've seen it. I mean, I've been looking at this for a very long time, and I like to challenge professionals, even like Dr. Hutcheson, because because I see some other YouTube clips on like forward head posture is an epidemic, but it's been around for a very long time. But there's other factors that we have to look at, and the areas of pathology we were talking about before we were recording is physical, chemical, emotional, and also spiritual. And let's face it, we do know that someone who is scared before giving a talk in front of the room, or their fear at the sight of blood, their brain will make them pass out. So the brain is a very powerful tool of healing. And that's what even gets in the way, because I know when I was at my peak of suffering, before I tried prolotherapy, going to more of the manual thrusting adjustments, and I was in a very, very bad place at that time. And so those since I was getting scared to try anything. And so at this point, this is the question I think I find in the community is regarding those who are too scared to do anything. You're probably right now maybe wearing an aspen collar or a soft collar. You're probably laying down a lot more often. How can we help patients to not isolate themselves and think, I need fusion. My life is over, I need fusion. How can we get them to trust the community again of conservative, from chiropractic care, even regenerative medicine?
Yeah, that's a great question. And my answer to that is that the very best surgeons require you to do prehab and rehab. So even if you believe that you absolutely need to get a fusion, which you may, and I've sent patients to get fusions and they've done very well. It's a C0 to C2 fusion. I have one patient in mind that I sent and reduced her seizures down 95%. I mean, she would turn her head to the left and she would start seizing and have to fall down to the floor after 10 or 20 seconds, and couldn't get out of them unless I did a very specific adjustment, or she took a super strong, almost like a tranquilizer type intranasal medicine that could help get her out of it. I mean, it was very severe. So surgeons can save your life, and they are one of the options for these kind of injuries. But prehab is going to be very important, and if you're not doing something to try to improve your functioning, then I think you're doing yourself a disservice. So it would be wise to find, I have one person that I'm consulting with right now that said, Robert, he said, I'm in bed 22 hours a day. And so I told him, I said, even if you're going to go and get these other things done, you need to find a way to only be in bed 20 hours a day and then 18 hours a day. And so you need to have something you're doing proactively.
Yeah.
So let's start. Let's see what little exercise can we give you to have you start being a little bit more functioning, so your body's laying down better connective tissue, so that you're giving yourself a chance to be ready for whatever regenerative procedures you do, or to respond better to healing from surgery. After you get a surgery, your body needs the building blocks to still, make that really, have the longevity that you want.
Excellent.